Okay, so right now we are going to look at the kidney failure and its types. So kidney injury is divided into three types. One is the pre-renal renal failure, pre-renal failure, intrinsic renal failure, and post-renal failure. This is according to the anatomical position of the kidney. Now, when pre-renal failure occurs, means there is some problem related with the vessels which are before entry into kidney. Intrinsic renal is involving kidneys and post-renal is involving the ureter or prostate or any other malignancy in the ureters. So in this way, this failure is divided into three types. Now, for kidney failure, what workups will we perform? We will perform history and physical examination, urine evaluation, and some tests like urine output, urine lysis, urine sediments, electrolytes, and osmolality is performed in order to look at the underlying cause of failure. Okay, so renal ultrasound is also done in order to rule out obstruction or size of kidneys evaluated on the basis of ultrasound. Chronicity of disease can be also found on the basis of ultrasound of the kidney. Workup serology of glomerulonephritis, renal biopsy in case of remnants. So in this way, we will work out for kidney injury. Now, coming to the first type or classification type of the kidney injury, that is pre-renal failure, acute kidney injury. It is most common cause of the acute kidney injury, and it is reversible. Causes are decreased efferent arterial volume. Now, it occurs because of hypovolemia or because of congestive heart failure or because of sepsis. Now, as I already mentioned, this is kidney and this is ureter coming out of the kidney and the blood from renal arteries supplying to kidney. So, when heart failure occurs, then pre-renal injury can happen, or hypovolemia can also precipitate in pre-renal injury. Sepsis, congestive heart failure can cause pre-renal injury. That's why we call it pre-renal failure. Local cause are renal artery stenosis. When this artery is stenosed, means narrowed or blocked, it results into impaired blood supply to the kidney, and it results into the renal artery stenosis and pre-renal kidney injury or renal vasoconstriction because of certain medications like NSAIDs, SCE inhibitors, ARBs, contrast agents. Hepatorenal syndrome can also cause pre-renal injury, renal kidney injury. Now, what is how can we diagnose, or what laboratory investigations are required? Cast will show haline cast. Blood urea nitrogen and creatinine ratio will greater than 20:1, and urine sediments will be performed. Urine osmolality is also performed in order to rule out. Management will be correct the underlying cause. If patient is congestive heart failure, then we will treat the failing heart of the patient. If patient is hypovolemia, we will treat according to the hypovolemic protocol, and the hypovolemia is treated with the restored blood, monitor central venous pressure. Inotropic agent should be given in the case of heart disease. If there is acidosis or the burn, in that case we will also correct those underlying cause and treat the patient. So in this way, pre-renal kidney injury, pre-renal failure of the kidneys can be managed, and we can save the life of the patient.